Rosemary Rizzo Parse, the nursing theorist on human becoming. Rosemary graduated Bachelor of Science in Nursing from Duquesne University. She's the youngest person in the US at that time to hold a master's degree in nursing, where she went quickly through school. She earned her doctor's degree from the University of Pittsburgh and became the first dean of nursing to hold a PhD. Man-Living Health Theory was the original name of her theory, but in 1992, she officially changed the name of her theory to the Human Becoming Theory to better reflect its focus on mankind without gender distinction. Rosemary's theory of human becoming is focused on the quality of life and human dignity through developing an effective relationship with the patient. The goal of the human becoming nurse is to be truly present with people as they enhance the quality of their lives. It develops trust and mutual understanding of care, relieves stress, and facilitates healing, all of which are the foundation of holistic care and nursing. And the nursing paradigm includes the following, such as person, where they see or it sees a holistic view approach to patients. The second is the environment, where the environment and the person are connected and cannot be separated, as well as health, which involves openness, the presence and the person and environment. And lastly is nursing, which is reliant to the presence of the nurse in order to care for them in their health within the patient's environment. So, the main concept of the theory focuses on the interrelationship between human beings and the universe that makes it a philosophy. Human beings co-author their becoming along with the universe, co-creating distinct patterns. Human beings cannot be reduced to component parts, and human beings are intentional, assigning meaning to events they experience. There are three major assumptions about human becoming, which are meaning, rhythmicity, and transcendence. So let's take a look at each subgroups. The first one is meaning, where human becoming is freely choosing a personal meaning in situations in the intersubjective process of living value priorities. Structuring meaning multidimensionally is co-creating reality through the languaging of valuing and imaging. And when we say valuing, it is the process of choosing and embracing what is important, while imaging is something that is being created of one's own reality, and one's reality reflects who one is, a unitary person. Languaging is being able or is about the ways a person could express themselves to the world, which can be verbally, written, or in their actions. An example of this subgroup in the aspect of meaning or valuing is that, say, a woman who underwent a surgery or a heart surgery because of a heart block, suddenly, or become more concerned about her health, and so through this way the woman exercises and watches her diet since then. By acting this way, she shows that she values health. The next subgroup is rhythmicity. Co-creating rhythmic patterns of relating is living the paradoxic unity of revealing, concealing, and enabling, limiting while connecting, separating. With revealing or concealing is the process where humans used to show or hide personal evolution or becoming. It involves how much we share about ourselves with others. Enabling limiting is like making choices and living with the consequences of our actions. While connecting, separating is a pattern of connecting and separating with people, things, and places. An example of this application in this subgroup is the enabling limiting, wherein a patient, say, refuses diagnostic treatment. However, in this option, he or she expresses his free will and autonomy to himself. Lastly is transcendence. Human becoming is co-transcending multidimensionally with emerging possibilities. This refers to reaching out and beyond the limits that a person sets. In this subgroup, it includes powering, originating, and transforming. In powering, it is the pushing, resisting process that propels people in life through the difficult times, while originating is about human uniqueness and the ways persons create their own becoming as they choose from all possibilities that could be, while transforming is about integrating unfamiliar ideas or activities into one's life, change for the better, and becoming a new entity. An example of this application in the aspect of transforming is that when an elderly man finally accepts help from outside, when he is no longer able to care for his wife, and so with this, he feels relieved. He feels that he has help, and his life is being transformed into something different or new. So, the question is, how does this theory or philosophy relate to the 21st century nursing practices? And or why is this theory actually important? So this theory actually helps nurses function therapeutically in interactions and thus helps to understand behaviors of patients, their families, and themselves. It also guides nurses in their practice to focus on the quality of life as it is described and lived. It presents an alternative to both the conventional biomedical approach and the biopsychosocial spiritual approach of most other theories in nursing. So the quality of life is explained from each person's own perspective. Now let's take a look at the advantages and the disadvantages of this theory. Rosemary's theory is very unique in the sense that the theory enables to see the patient's perspectives in terms of their experiences, and it helps the nurse and guide them on which approach are they going to do. And the nurse person relationships co-creates changing health patterns, and this also differentiates nursing from other disciplines because it actually carries out the caring ability or the caring or nursing aspect where one should truly be present with the patient and engaging with the patient as well as truly establishing a good rapport or relationship with them or with the patient. One of the drawbacks we could say only is that this type of theory is not that much accessible to novice nurses due to lack of experience. It's because with this theory, I think you truly have to spend time with your patient, assessing the patient from physical to social to spiritual aspect of the patient. However, this theory truly applies to nursing as the quality of life is the goal of nursing or of this. The belief that human beings are free to choose is fundamental to the practice of nursing, with all actions focused on guiding humans toward ways of being, finding meaning, and choosing ways of co-creating their own health. The next part of this presentation is about the case scenario where it reflects the theory of human becoming. So our case scenario would show nursing care which involves utilizing the nursing body of knowledge to help our patient attain desired health outcomes through his own perspective. And in order for this to take place, it is important for the nurse to be with the patient to establish a nurse-patient relationship, and the relationship facilitates the patient towards human becoming. Applying the Rosemary Parse's theory, nurses would not just merely focusing on treating his or the patient's condition through complying with the hospital procedures, because providing nursing care is more than that. It involves focusing on utilizing a nurse's presence with the patient. In our example, the nurse will apply the process of illuminating meaning through explicating, synchronizing rhythms through dealing with, and mobilizing transcendence through moving beyond. So, we have Mr. SC, who is a 49-year-old guy who was admitted in the medical surgical unit due to nausea and vomiting. He's been throwing up a coffee ground output and was in worst pain, 10/10, for almost a week. He's been trying to eat but really unable to keep it down. He was getting Safran 4 milligrams every 4 hours IV and morphine 3 milligrams IV every 4 hours, but it seems like it's not really working for him. So for almost a week, he's not really keeping anything down, and he's just trying to tolerate his pain with help of regular Tylenol or acetaminophen, but it's not really helping. So Mr. SC decided to go to the hospital, and so he was admitted to the medical surgical unit. In the unit, an urgent GI consultation was done and he was finally seen after a few hours. The patient was really restless and been wanting to eat and have a higher dose of pain medications, but it's not really, which is not helping him. So when he was seen by the GI doctor, they immediately ordered a gastroscopy to see where the bleeding is coming from. However, the patient strongly refused, and the doctor is saying that he is signing off because the patient is refusing. So the next part of the presentation will show or reflect the application of Rosemary Parse's theory.
Client assessment. Based on Parse's theory, for nurses, the health and quality of life are important to the patient. In the case of Mr. Carver, he was in pain in a scale of 10/10. He was restless, he's been trying to eat but unable to keep it down, and have a higher dose of medications, which are Sofran and morphine. The quality of life for Mr. Carver that he is experiencing is lack of comfort, happiness, and was not able to participate in doctor's advice for gastroscopy. The situation of Mr. Carver affects his physical and social well-being. Nursing interventions. It is important for nurses to be with the patient to be able to know more about his condition. Nurses should learn as well as integrate the values and beliefs of the patient from Parse's theory. Nurses should provide the ability to know and to see the patient's perspective to be with the patient, and these would guide Mr. Carver to achieve the health outcomes that he desires. Furthermore, based on Parse's theory, a nurse-patient relationship can help change Mr. Carver's health patterns. This will help in enhancing Mr. Carver's well-being by interacting with him, spending time, and understand his health needs for the enhancement of his health.
Goals and evaluation. To provide symptomatic relief from pain scale 10/10, eliminating meaning through explicating, the nurses first strives to gain a clear understanding of Mr. SC complaint. This can be done by being with him as he eventually reveals more of his feelings of what he was experiencing. To provide symptomatic relief for vomiting and nausea. Synchronizing rhythms through dwelling, Mr. SC had expressed his illness having symptoms of vomiting and nausea. Hence, nurses must make a decision and should follow it and must avoid any attempts to counter it. This will allow client to express more of his thoughts that results to further self-discovery. Making him more synchronized can help in developing better health patterns. To prevent gastrointestinal irritation and bleeding, Mr. SC must need to undergo gastroscopy. Mobilizing transcendence through moving, when Mr. SC expressed about his illness, the nurse realized that he was anxious about gastroscopy. In this case, nurses must guide client on overcoming this anxiety. This will make SC move beyond his anxiousness. The goal of the human becoming nurse is to be truly present with people as they enhance the quality of their lives. It develops trust and mutual understanding of care, relieves stress, and facilitating healing, all of which are the foundation of holistic care and nursing. The nursing metaphrasm included the following: man, a holistic view approach to patients despite having bleeding. Mr. SC must still be viewed as a being more than his parts. Aside from merely focusing on bleeding, it is also important to look into him on overall perspective. The environment and person are contacted with and cannot be separated. Mr. SC experiences in the environment became an integrated part of him. The illness, family, and work are part of him, lived experiences which he must synchronize with. Health involves openness to presence and the person and environment. Mr. SC undergoes the open process of becoming by processing his value for synchronized rhythms. Through this, he is able to make a health decision and overcome his illness. Nursing is reliant to the presence of the nurse in order to care for them in their health within the patient's environment. Nursing care involves utilizing the nursing body of knowledge to help Mr. SC to attain desired health outcomes through his own perspective. In order for this to take place, it is important for a nurse to be with client to establish a nurse-patient relationship. This relationship facilitates Mr. SC towards his human becoming. The patient will agree and understand the importance of submitting himself for gastroscopy only when nurse speak, listen, and spend time with the patient, digging why the patient is holding off from the procedure. Human becoming approach. The key concepts and its assumptions. The goal of nursing in caring for Mr. SC to ensure that he regains his quality of life based on his own perspectives, he had to refuse performing gastroscopy. In order to attain this, the nurse must be with the patient, unfold the patient perspective, and assist him in attaining desired health outcomes. Black and white, opposite paradox signified to ontology of human becoming as the physician is ready for the gastroscopy. However, the client refuse and we must look forward for hope make the client agree for the gastroscopy as green cross showed. Totality paradigm. He was unable to establish a life rhythm by refusing the gastroscopy by the physician. Counter, the joining of the interviewing thrills at the center represents the ongoing process of Mr. SC human becoming through the nurse-patient interaction. Thank you.
About man. The human is open, freely choosing meaning in situation, bearing responsibility for decision made. Mr. SC freely decided not to go for gastroscopy as he is aware of the possibility of experiencing anxiousness about revealing the truth and the diagnostic and had not chosen as he may not want families to know about his illness. About becoming. Becoming is the human's pattern of relating value priorities. Mr. SC is aware that his priority is family and other members, due of which he transcends from his anxiousness and decides to refuse the gastroscopy as he don't want his family and other members to reveal the truth about the diagnostic and put them in anxiety. With this, he may not recover, however, would not provide more trouble to family and other members and can stick to his priorities. Now in the assessment, screen for the presence or risk of any type of pain, performing a comprehensive pain assessment on persons screened having the presence, or risk of any type of pain using a systematic approach and appropriate. Validated tools and on persons who is unable to self-report using a validated tool, explore the person's beliefs, knowledge, and level of understanding about pain and pain management. Document the person's pain characteristic. First, identify the cause to control the symptoms. Multiple causes for these symptoms often occurring simultaneously. It is essential in your assessment of nausea and vomiting to identify the likely source. This information may be gathered from the referral notes, known history of the patient, and clinical assessment. Second, consider also any pre-existing comorbidities such as gastroesophageal reflux or GERD, gastric ulcers, and dyspepsia, indigestion, as client had been throwing up a coffee ground output. This may not necessarily relate to the advanced disease but could also be a cause of discomfort. And the third, many of the medication commonly used in palliative care are known to contribute nausea and vomiting. These include opioids, especially morphine, antimicrobials, and antidepressant. It is important to review the medication being taken by the person in your care. Mr. SC should avoid consuming medication which stimulate nausea and vomiting, included antibiotics like erythromycin, corticosteroids, cytotic agents, and especially nicotine gum or lozenges, and NSAIDs can lead to gastric bleeding if taken in excess dose with empty stomach. Hence, Zofran 4 mg every 6 hours intravenously with maximum dose up to 8 mg can be given. Now for evaluation, reassess the person's response to the pain management interventions consistently using the same re-evaluation tool. The frequency of reassessment will be determined by presence of pain, pain intensity, stability of the person's medical condition, type of pain like acute versus persistent, and practice sitting.